Good morning. Thank you for being here this morning. On behalf of Continuing Dental Education Office, I'm pleased to welcome our guest, Dr. Farah Lalwani. Dr. Farah Lalwani is a general dentist at the MOH since 2006. She is internationally certified 500 yoga and meditation instructor and a life coach. Dr. Farah has been providing group classes and private coaching sessions since 2013 that have helped people develop work-life balance as well as emotional calmness, mental clarity, and motivation for healthy and happy lifestyle. Today, she will be sharing with us her expertise in managing anxious patients within the clinic using practical methods. I would like you to enjoy the talk given by Dr. Farah. Dr. Farah, the mic is yours.
Hello, everyone. Good morning, and thank you so much for being here. I have noticed that most of you have switched off your cameras, and I would ask you as an option to switch them on so that I can see your faces and that we can interact, because this is a beautiful interactive workshop for you. Okay, so, all right. It's entirely up to you, and I also ask you to participate. You have the option of participating in the chat, and when appropriate, you can switch on your mics and speak to me as well, okay? So welcome to this beautiful workshop for you, designed for you, so that you can manage dental anxiety for yourself and for your patients. All right, so let's begin with our instructions. I would love to know, though, in the chat box, if you could tell me where you are working, whether you're a GP, whether you're a specialist, private, or Ministry of Health sector. I would really like to know who is here right now and how I can help you more with these issues, okay? All right, so initially, if you're not using your phones, please switch them off or put them on silent, and be open to receiving. Perhaps some of the concepts that you will learn will be new to you, and just come with an awareness, with an open mind. Take what resonates with you, leave what doesn't, okay? Bearing in mind that this is recorded, so if it's okay for you to show your face on the screen, just to let you know. Good morning, Dr. Maher, Mohammed Maher. Thank you for responding. All right, and as well, you can take notes if you like. And before we continue, I invite you to come into a full presence. And how do we do this? We're gonna do a little exercise before we begin so that we can all be in the same place and the same time in the here and now. So I invite you to, wherever you are, whether you're sitting or standing, placing your feet on the floor, becoming aware of your body here. So you have the choice of softening your gaze, looking down, or closing your eyes if it's safe for you to do so. So begin by becoming aware of the base of your spine and your sit bones on the chair. Becoming aware of your feet on the floor. Your shoulders, the heaviness of your shoulders draping down, and your arms flowing down from the shoulders, your elbows and your hands on your thighs. Becoming aware of your head and your neck. Bringing your awareness to the breath, noticing the cool air coming in through the nostrils and out. And let's do this one centering breathing exercise, which I will tell you a little bit more about later. It's called ocean breathing. So I invite you to do this with me. I know I can't see you, but the more you interact, the more you allow yourself to be in this experience, the more you will understand and feel what it is that I'm talking about, okay? So ocean breathing is basically, we're going to breathe in through the nose and then exhale out of the mouth completely, making this kind of noise. It's like you're forcing the breath out and you're constricting the throat. And the purpose of this is it really helps us to calm down the nervous system and brings us fully into our awareness, into our body. So let's begin. Breathing in through the nose. Filling the lungs completely in all directions, sitting a little bit taller, exhaling out of the mouth. Beautiful. 2 more times, breathing in through the nose, out of the mouth completely. 1 more time, breathing in through the nose, breathing out completely. Beautiful. When you're ready, bring your awareness back. I'd love to know how was your experience with this little exercise that we did. It's a grounding exercise. It helps us to come back to our awareness, our body, which is where all the sensory information is. Disclaimer, the information here is strictly for reference and educational purposes. It's not a substitute for diagnosis or treatment of any kind of medical psychosomatic condition, okay? So if you know of anyone who really needs the care, the help they need, obviously refer them to a licensed mental health practitioner, psychiatrist, and mental therapist. All right. We always love to begin with a quote. A positive attitude gives you power over your circumstances instead of your circumstances having power over you. So I know that this seems very familiar, but how often do we actually maintain this positive attitude? So I invite you to come into your day, every day, with this positive attitude so that you can have that sense of control over your experiences, over your life, over whatever's happening. Because really, that's the only control that we have over our attitude, over our thinking, our emotions. That is the choice that we have. So my name is Dr. Farah Alwani. I've been here before. Some of you have been attending with me before. I'd love to know how many of you have actually attended my webinars before. The reason why I got into this whole experience was because I suffered from anxiety. I was living a very stressful life. I was what you call a type A personality. And this got far more demanding life when I had kids. When I started to try to juggle having a work-life balance, things completely got out of hand. And I knew I needed to find some other way of living, breathing, being that was beyond what I was doing. And I really didn't want to go through the pharmaceutical path. So that's when I started my journey about 11 years ago. And I learned so many different technologies. I immersed myself in these studies and I love it. It's what sparks my passion. And anything that I teach, anything that I give to others, I have most definitely practiced it on myself. And I have been through it myself, and I only teach what I have received positive experiences with. So I've studied trauma and stress physiology. I have just finished 6 days training in trauma-informed yin yoga, which is how do you deal with people who have been through trauma. It's important for us to understand this concept, especially as medical professionals, and I'll be sharing more about that in a while. I have someone here talking to me. I attended many. Okay. Yeah, thank you so much for always being there. I appreciate it. So I've explained to you my qualifications. I have actually I have about 600 hours of training, or even more than that. And the purpose is for us to always evolve and expand. And for me, it's all about giving back a little bit of what I have learned back to the community. And I remember when I first started learning these technologies, these techniques, the first thing I thought of is I need to teach my fellow colleagues all of this stuff. I need to teach them just whatever they are desiring to learn, but how to have a better work-life balance, how to have control over those over-anxious experiences that we tend to get put in, being a very technical field, medical field. It's very similar to surgery, right? So we're always operating, we're using many facets of our being. In one point, we're functioning, we're using our mind, we're using our hands, our legs, our feet, we're analyzing, we're creating, we're doing. So there's a lot that's happening, even though we take it for granted now and we got so used to it, but we are using so many faculties of our being, and we need to make sure that we are functioning at optimal level, right? Really can't afford to make any mistakes when we're operating with heavy machinery, right? So introduction, fear and anxiety towards the dentist and dental treatment are significant characteristics that contribute to avoidance of dental care. And this is what leads to the dental anxiety cycle, right? patients are anxious, they're afraid, they delay their dental visits, and they only come when things are really out of hand. And then when they come, they're coming with their anxiety. They may not have a very positive experience, and then that adds to that anxiety and the fear as well. So what are you going to learn today? Number one goal is to raise awareness of the existence of this dental anxiety cycle, and as well, existence of trauma, people who have been through trauma who are entering our clinic, right? We're all humans. We've all been through multiple kinds of experiences in life, and we all respond differently. And how this thing may transfer into the dental clinic, and how it may actually cause the patients not to receive what they desire because there's something else that's happening in the background, right? Number two, learning assessment tools to help you identify that this is happening with you in the clinic. Number three, common mistakes dentists make that trigger the anxiety for patients. Number four, practicing effective management in the clinic for you. So raising awareness of the effects of the dental anxiety cycle. I also want to add, if you have any questions that come up, please put them in the chat box and there will be time for us to go through them. We start with statistics. I found this one that was from Kuwait. Previous findings among the Kuwaiti adults have shown that one of the most common reasons for not attending for a preventive dental visit was dental fear. And this was done in 2007. I wonder if patients actually do come in for their regular checkups. I mean, how often does that happen that someone comes in and just says, yeah, I'm just coming for my 6 months checkup, right? They come in, or perhaps they're coming in for scaling, right? And they say, please check me up. I want to just have a look what's happening with me right now. Does that happen or does that not happen? Okay. I know that it happens, but maybe not that frequently, maybe 1 out of 10. I'm not sure. But here's another study that I found in Kuwait as well in 2010. It says that in Kuwait, anxiety and fear levels towards dental treatment ranged from not nervous to extremely nervous or terrified. About 14% were falling in the category of being extremely nervous or terrified. 29% canceled or postponed their appointments due to fear of dental treatment. Imagine 29%, that's like 1/3 of clients, 3 out of 10, right? The majority, which is 60% of the total sample, indicated that they were willing to go if they would receive medication to reduce their anxiety. That's a large amount. That is really a large amount. And you know, and we know that we are not allowed to prescribe these kind of medications. So that means that we need to have this collaboration with a professional who can actually prescribe those. And yeah, so 41% showed interest in receiving general anesthesia with their dental treatment. So just to clarify, I will not be covering these things because these are not within the scope of us as GPs working in the public health sector. We actually don't have access to these, right? We would have to refer them to a professional, refer them to specialists who can actually go ahead and do those things. And even in those cases, most likely they will be put on a list. And that is probably the main reason why people actually are going towards the private sector, because they can just walk in and arrange all of this for them to happen. And we all know that general anesthesia has its side effects, right? Not everyone is actually indicated to go for the general anesthesia, right? And the conclusion is, the study shows a high prevalence of self-reported dental fear and anxiety in the Kuwaiti population. No surprise. No surprise, yeah. And it's actually easier when people actually tell us. It's much easier when they say, doctor, I have a fear, I'm afraid, I'm worried, I haven't slept all night. Please be gentle with me, right? I agree. Please be gentle with me. Please, you know, some people will tell you ahead, right? Some of the patients who are your regulars and you've created that relationship with them, you will know, right? But a lot of times we don't know, because anxiety can manifest in so many different ways, and we may misinterpret it as being rude, aggressive, non-compliant, right? We can label it as so many other things, but in the end, it could be just a fear. So what is anxiety? We keep throwing this word around. It's a feeling of worry. It's a feeling of nervousness, unease about a future event, something with an uncertain outcome. Yeah. Basically, it's overthinking, over worrying about something. And all of us, I'm sure at one point in our lives, we have this experience, It's not something uncommon. Dental anxiety has so many names: dental fear, dental phobia, odontophobia, dentist phobia, so many different names. And they go from extremes, as we've seen before. So it's the fear of receiving dental care. It's fear of going to the dentist. And as I mentioned, we get into this vicious cycle of dental anxiety, where they avoid dental treatment, their oral health gets worse. By the time they come to you, they need more complex treatment, and they're super uncooperative anyways. So it becomes really, really more difficult for you to manage them, which creates even more anxiety. One thing that because of the training that I just came off, I just wanted to introduce this idea of trauma awareness. And this is about having a general awareness of the presence and impact of trauma without specifically understanding how it impacts our patients. Trauma is defined by the lingering psychosomatic response to an overwhelming event. It is not the trauma itself. It is not the event itself. It's what happens inside of the person because of the event. So it's the physiological responses that happen to them, right? Because of whatever experience they went through. And there's big trauma, such as being in a war, all kinds of big things. And there's little trauma, which is things that we experience throughout the day, right? And medical trauma falls under the little experiences that may affect a person and may continue, their body may still respond from that place. So it's important for us to understand and acknowledge that anyone who may be entering our clinic is coming in with some kind of trauma history, and the stress response may be triggered inside the dental setting. So did you know that even all of us being in the pandemic, this is considered a form of trauma as well? This is considered to be collective trauma, and all of us were in the pandemic, and it affected each and every one of us very differently, right? And the way that our bodies respond, our physiology, our nervous system, if we get stuck there, if it gets stuck in any one of the responses, the stress responses, a person may be operating from there to such an extent that it may become part of their personality. Okay. So we just need to be aware of this so that we don't re-traumatize them within the clinic, especially if they're already very sensitive, and especially if they've gone through specifically a traumatic experience inside the dental office, right? So safety is at the core of trauma integration. And that's what happens to people when they're operating from that response. They're going into self-protection, right? So the number one thing that we need to be aware of, if you take one thing away, is make sure that you are providing a safe environment, a safe space for them, so that they can receive what it is they need to take from you, from your help, from your guidance, and leave with a more positive outlook, a more positive experience, relieving their pain or whatever it is. So 3 human basic needs. This is important for us to understand so that you know how our role, how the experience that they have with us is affecting them. The number one thing that all of us desire, all of us need as human beings, is we need to feel safe and secure, right? So this feeling of safety comes into the clinic by you making sure that obviously everything's operating well, you have a good grip on your equipment, you're not having like the ceiling falling or weird, strange noises coming out or faulty equipment around you. Yeah, this is your responsibility. Okay, and making sure as well that we don't have anxious patients knocking on the door and barging in, which may make the situation and the scenario even worse. All right, number 2, we all desire to feel connection and belonging. And it's crucial for us to have this, right? Number 3, dignity. We all want to feel that we are worth something, that we are worthwhile, right? And we are going to talk more about this in today's workshop, as how you can reinforce those 3 to make people feel like, to lessen the anxiety that they feel in the dental setting. And this is from Cleveland Clinic in the United States. About 36% of people in the United States have a fear of dental treatment, with 12% having extreme fear. About 3% of adults in industrialized countries, and we are considered industrialized, may have dentophobia and avoid going to the dentist at all. And fear of dentists, surprisingly, is more common in females than in males. And studies show that nearly 3% of men and almost 5% of women have this. Okay. All right. So what are the causes? I'm sure we all know them. We've heard them 100,000 times, but it's good to bring this back up again. Prior traumatic experiences, especially in childhood, right? So if you are a pediatric dentist, if you are dealing with children, just know that whatever experience you are giving them will remain with them, even on a subconscious level, for the rest of their lives. Because, children are like a blank slate. I don't want to go too much into the details of their physiology and their brain waves and how they absorb everything around them. They're like sponges. And the thing is, when children go through any kind of experience, it becomes like the lens in which they look through. It's like you're building something from scratch, and whatever experience that you are giving them in the clinic, and it's not just us, by the way, it's also when they go get their vaccinations, when they go for the medical checkups, and they see the white coat, and they associate them all together as part of the medical field. And now when they actually come to you, like I used to work with children for the first 5 years of my career, and it wasn't the easiest job, but it was the most rewarding. I really did enjoy it. And we had our protocols in place, right? We had the Franklin system where we could classify them F1, F2, F3, F4, and then we would accordingly, and they would all be in the chart, so that before the patient comes in, you have a really good idea of who's coming into you. And this was one of the benefits of working there, was that you had an idea of the character and the dental treatment that you had to do, right? So you had that kind of forward thinking, planning ahead, right? So yeah, just know that it starts from childhood, but know that you can fix it, you can shift it, you can change it. Nothing is fixed in stone. As human beings, we are malleable, we are flexible, right? We are resilient, we learn, we change. So don't take this in a negative light if you have people who've been talking about this, but obviously know that if it's extreme trauma, then they need to go to a specialist who can help them. Another thing is negative experiences from family members or friends, the stories that they hear or the things that they see, right? If they see their parents having the stress response, crying, screaming, holding their face, especially after the clinic or before the clinic, or they see swelling, it all affects us. It affects them and their experience. Individual personality characteristics. Some people are naturally, they have more fear, right? So they have more dental related fear would be like fear of gagging, fear of choking, fear of blood. They don't trust the process. They don't know what's going to happen. They are overthinkers. Their minds tend to overthink the small details, right? Their mind is very creative. It's very analytical, and they start to visualize everything. They start to look for the worst case scenario. Yeah. In addition, the sense of helplessness that people feel when they're in the dental chair, it's like a feeling of lack of control because they're lying there already, they're in the supine position, which already feels very vulnerable, right? And we're working in their face region and in a very sensitive place, in a very small area. So all of these things contribute as well. And as I said, they're physically vulnerable. So they don't know what may or may not happen, right? Embarrassment, perhaps they have really bad oral health, they have an issue and they're embarrassed to come and show it. They don't understand. The dentist sometimes doesn't understand what's happening or doesn't give them the time to ask the questions, to take the history, to really get a grip of what's happening. Sometimes it's not very clear what's happening, right? We don't know if it's like a crack in the tooth, or we can't diagnose it properly, and patients can tell, especially when we're umming a lot, or where we don't have this aura of confidence around us, yeah, or we don't ask enough questions. People can tell. As human beings, we understand each other, and we know, we can feel, we can sense things, right? And it's not bad. It's not a bad thing to say, you know what, I'm not sure. It's not a bad thing. It's better to admit something than to just pretend you know something when you don't, or give them a treatment that was unnecessary, right? So it's okay to say, I don't know, let me think about it, let me ask someone, let me get a second opinion, that's okay as well. And then of course we have the sensory triggers, the sound of the drill, the smell of the antiseptic, the smell of the cut dentine, seeing the syringe, seeing the needle, all of these things. And then some people have unconscious fear that eventually becomes something serious and becomes very phobic. Okay. So I mentioned some of these, but what does he fear? Obviously, this thing, this beautiful long gauge needle is one of the biggest fears that people have. We know that. So they fear the needles, they fear the anesthesia, they worry that it doesn't work. They worry that it lasts forever, numbs their lips and numbs their tongue. They worry that it goes in the wrong place and numbs something else completely, like their throat. They're unable to swallow. The noise itself, the smells. Even some of our like I remember the IRM had a very, very strong smell, right? So all of these things, they tend to create that, especially in sensitive people. The sight of blood. Some people really cannot stand even a drop of blood. It freaks them out. Some people are afraid of the dentist. They associate negative feelings with their dentist. And interestingly enough, before I did this, as I was preparing for this lecture, I asked a few people around me about their experiences at the dentist. And the first thing that someone said was, like, what are the things that cause you anxiety when going for a dental visit? And one of the first things they said was, it's the dentist. If he's moody, if he's grumpy, if he is closed, if he's not willing, if he's not smiling, all these things put me off, right? So that is so interesting. You know, that is so interesting that even though they are coming to you, they are associating your body language with, I totally agree, with this negativity, right? So I mean, that's easy. We can fix that, right? If it's just us that they don't like, then we can fix it. We can smile. We can, you know, shift that. I mean, I think that's very easy if it's just that, right? But that's one of the first things. People are afraid of feeling more pain, because the reality is sometimes they will receive more pain before the pain really goes away, right? So sometimes the procedure will cause them pain, you know, post-operatively, they will feel a little bit of pain. So the pain itself is like they don't know how much more pain they will get, right? So they'd rather avoid altogether and just keep on taking their NSAIDs. Yeah. All right. Assessment tools to help identify the issue. So what are the symptoms? So let's talk about the symptoms first. So symptoms, like if someone comes into your clinic, how do you know that they're anxious? Sometimes they'll tell you. Sometimes you'll see it physically. Sometimes you'll see them shivering. They'll feel cold. They'll be like, doctor, it's cold in here. I'm cold. You'll see their extremities trembling. You'll see their lips trembling, right? Maybe someone will walk in and they'll be holding them even because they're in so much anxiety that they can't even lift themselves up. They'll tell you, I'm dizzy, I'm lightheaded, especially when they first sit down and you begin to bring the chair back, or you're maybe after the anesthesia, maybe before the anesthesia, but these are all signs, symptoms for you to watch out for visually. Excessive sweating, you'll notice that they're physically, you can see the sweat pouring down their face. They'll start to get heart palpitations. You can't see that, but you'll begin to maybe notice it in their voice as they're trembling. They may tell you that they're nauseous. They'll be breathing really short breaths, and you'll notice that it's just chest breathing. It's like this, right? That's shortness of breath. That's an indication for you that this person isn't okay. They're not feeling well. You know, something's wrong. Trembling, shaking. They may tell you they have an upset stomach, or they may be holding their stomach, right? They might tell you, yeah, since yesterday my stomach hurts, or they may not, but you need to be really vigilant and just scan them from head to toe and notice, like, who is this person in front of you? What is it that they are going through? In addition, they may trigger people to cry when thinking about going to the dentist, or having insomnia the day before. I remember that many times this happened on a few occasions for me, and this is why I had this big interest in transmitting this information into the dental clinic. That patients would come in and she would start telling me things about her husband, like she's only coming, and then she would start telling me about her issues with her husband, and then she would just break down and cry, right? And And here I was thinking that she just came in for like a filling, but actually just being in that vulnerable position and feeling that she had someone that was physically close to her, but also someone who was giving her care, that she was able to let go and just, you know, tell you whatever she was going through. Yeah. So just remembering that just like going to the salon, like women know this very well. Sometimes when you go to somewhere, like a salon or someone who is going to take care of you, your boundaries kind of drop and you're able to really express what's happening. So this may or may not happen to you, and using your own intelligence, you will know how to deal with this, right? Like maybe she just came and she's not up for doing a pulpectomy today. She's sitting there and she's breaking down and she's having all these issues, these social issues. She's not ready to go for a full-fledged pulpectomy, right? So perhaps it would be smarter to do something less intrusive, right? Maybe just doing a scaling or a polishing or something that's much lighter, that will give her that feeling that you've done something, but not something that's to the far extreme end. Unless obviously she's in extreme pain, then you would know how to deal with that. And then if you know that this patient is irregular, then you maybe perhaps preparing ahead of time, like preparing them ahead of time. Like if you know that someone is super sensitive and you know that they're going for pulpectomy, I mean, maybe advising even to take an NSAID before they come, like an hour before they come, just take, have your light breakfast and just take your cataflam or ibuprofen, whatever it is that you're going to prescribe for them. And it would help them also to relax, and it will release some of the pain as well. So we know that when someone is triggered, they go into a stress response, which is fight or flight. I'm not going to go into the details. I know previously I have, but we all know what that's about, right? When we're triggered, when something evokes that sense of lack of safety, then each one of us has a very different way of experiencing and expressing it. So sometimes someone will be anxious, but they won't give you those symptoms. They will be actually in a fight mode. In a fight mode, they will look like they're coming in and they're trying to pick a fight with you. They're aggressive. They are their face may be red. You may notice the same symptoms, like their chest is they're shallow breathing through their chest. You may notice that their eyes are like really open, and you know that they're mad. And sometimes if we are not regulated, we will take it personally, especially if they've been sitting around in the waiting room for such a long time. We need to understand and be compassionate to this, that people are sitting around for a very long time waiting for their turn, right? So this also affects them. For some people, it may increase their anxiety. For some people, it may decrease it, because then they've got that long time to sit and keep their minds busy with something else. Okay, so here you can see many of the symptoms of the fight or flight. And some people are flighters. Flighters mean that they will respond differently. So maybe they will be very chatty. They will talk really fast. They will be like, okay, let's get on with it quickly. Let's do this. Or they may ask you like 101 questions. Like, okay, so what are you going to do now? And so what do I do after? So they'll be like this kind of nervousness, this hesitation, right? And just understand that this is their physiology that's affecting them. So that they're not normally like that, but just being in the setting has triggered something. Okay, so maybe they'll be like, their eyes are darting around the room. Maybe they're watching your every move, and it can get really irritating for us, right? I know I can understand that. Like, why is it that, we have to deal with this? But we have to understand that this is part of our profession. When we decided to become dentists, I'd love to know why you decided to do that. This is part of something that, we need to deal with. Perhaps we didn't learn skills at university to deal with them, but I'm hoping that in the future that they start to incorporate these more patient management courses within the program, because it's like half of our work, right? We're dealing with human beings. These are not just objects sitting there. No, they're alive. They have their own experiences. They have their own ideas, right? So yeah, so just become aware that symptoms don't always appear the same. Now, talking about the trauma response and stress response, there's these two others that we also need to be aware of. So as we said, fight people, they can come off as angry, they're attacking, they're distrustful, They may question your treatment modality. They may start screaming. They may be demanding, or like they'll like push away the nurse's hand, or they'll start to like physically become uncooperative. So understand that this is their stress response and it's not personal. They're doing this because their body it feels unsafe, right? It feels unsafe. Flight people, they are anxious. As I said, they talk a lot. They're avoidant. Maybe you ask them a question and they won't answer straight away, or they say, I don't know, because they can't remember. Their mind is so busy, they can't remember. They may even forget. Like, this used to happen to me. I would eventually have to write down like whatever, when I would visit a doctor for my doctor's visits, I would forget what I needed to say because I was so anxious and just focused on getting myself there and into the clinic that I would forget. Like, I would have like 5 symptoms, I would only say 1. And then after I'd leave, I'd calm down. I'm like, oh my God, I forgot to tell them this and this and this was happening, right? So it's up to us to really do a good scan and to really do a good thorough examination and ask them questions, right? Involve them in the decision-making of the treatment plan. Are you ready to do this today? Look, this is what you need, A, B, C. Which one would you like to start with today? Give them the choice, right? Give them the choice to do that. And that is a more compassionate way of being, right? Some of them might hide, like you'll call their name in the waiting room and they'll just ignore you. And they'll show up once someone else has gone into the room, right? So just be more compassionate to them. So let's not get into, you were late, you did this, da 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 da, you know, like you were 15 minutes late and we called you, you know, just relax. You're the leader here. You're the one that they're coming to for co-regulation. You're the one that's there to help them. So just relax, right? Don't take it personally. Look at it from their point of view, right? Having that holding that compassionate space will really make you a better dentist. Even if you're not, like, technically you're not doing something like an amazing, maybe you're not doing your bestest filling with these people or the most beautiful designs, but it's okay. It's okay. Freeze-type people, these are the people that completely blank out. They feel helpless, they feel overwhelmed, they feel stuck, they tend to shut down, they zone out, they become unresponsive, right? You may mistake them as cooperative because they're just letting you do whatever. But when you ask them questions, are you okay? Are you okay? There's no response, right? They have gone into freeze. If you've ever been in this experience where you feel like you don't know what to do and you're just blank, especially if it's like a shock, you know, this happens mostly when we hear like a really shocking news, like you're just like completely blank and you don't know what to do and you're like staring out into space. You may encounter people who are responding in this way. Very interestingly enough, we have the fawners. Fawners are people who are sweet, they're talkative, they tell you, wow, I like your hair, wow, I like your scrubs, wow, I like the smell in the room. They will start complimenting you, right? And they will always like be nice and sweet and look like they're cooperative, but really their stress response is kicked in. This happened to me before, where a patient would start chatting to me about his business. He had a business of perfumes. And oh, what kind of perfumes do you like? Oh, I think you're this kind of person. You like Kenzo. You know what? I'm gonna make you a beautiful perfume, and I'm gonna send it to you. You're gonna love my designs. I make these beautiful smells. And I was like, okay, great, thank you so much. You know, I'm happy to do that. You know, and I would continue the treatment. I would finish, and he would just completely disappear, and I would never hear from him, and I would never see him again. I'd be like, but that guy said he was gonna, you know, I didn't ask him for anything, but in his mind, he was kind of like softening me up, buttering me up, they say, because he thought that if he was nice to me, if he would promise me something, a gift, and I would be much nicer to him, I would do a better job, I would be gentler on him, right? And this is the characteristic of a fawn person. So yeah. Is this interesting for everyone, or is this not interesting? I would like to know, is this something, have you considered this before? Have you thought about this before? And you may even notice that you'll start to analyze the people in your life, and you'll analyze yourself. I mean, this is the first thing that we do as human beings. When we learn something, we start to analyze ourselves. Oh, wow. Perhaps I have these tendencies. Perhaps when something surprising comes along, I automatically go into fight, right? Or maybe I automatically go into flight. Flight is like when you're running away, you feel like anxious. It's a little bit ADHD kind, where you're like all over the place. Freeze, you just like, you know what, I'm gonna sleep. You know, when you get like some bad news, you're like, I'm just gonna go to bed and I'm gonna sleep like 10, 12, 15 hours and I will not get out of bed. And this is because you feel helpless, you feel unable to cope with whatever is happening. And as a fawner, notice if you are always happy to please, always the one that everyone comes up to and asks for help, and you're like, yeah, sure, I'll do it, you know, no boundaries at all. No matter what they ask you, you're always a yes person, right? Very interesting. Thank you. All right. Now, there is actually a dental anxiety scale called Cora's Dental Anxiety Scale, and this is just for your reference. You may choose to use it or not. It's entirely up to you according to your own interest, but I thought it's appropriate for us to talk about it because it does exist. This was designed by Dr. Norman Cora in 1969, and it's asking patients to fill out, answer these 4 simple questions, right? And there's 5 possible answers for each one. And then they designed the scale that if they got a score from 9 to 12, this indicates moderate anxiety. If they get 13 to 14, then it's high anxiety. And if they get 15 to 20 as a score, this is severe and maybe a phobia and may require help of a mental health professional, right? So we need to understand that as well, that not everything that we ourselves can handle. And it's okay to refer, and it's okay to say, you know what, I can't help you. Now, these are the questions just for your reference. Question number 1. If you had to go to the dentist tomorrow for a checkup, how would you feel about it? So obviously this is someone that would come, someone that isn't in your clinic right now, and perhaps someone that either a family member or, you know, someone out of the dental clinic would come to you. But this is how the scale goes. So the first question is, if you had to go to the dentist tomorrow for a checkup, how would you feel about it? Okay, and then there would be a score for that. When you're waiting in the dentist office for your turn, how do you feel? Again, it's about how do you feel, right? It's giving them scenarios, having them put themselves in the situation, and bringing on that feeling. When you're in the dentist chair waiting, while the dentist gets the drill ready, how do you feel? Okay. Imagine you are in the dentist chair to have your teeth cleaned while you are waiting and the dentist or hygienist getting out the instruments. How do you feel? This is so interesting because, as I said yesterday, I asked a few people. I asked 3 people, how did they feel about their experience in the dentist office? The first one said, I would feel anxious if I walked in and the dentist was not excited to see me, right? They were grumpy, they were moody. I would look at their behavior or and how they treated me, and I would just, you know, that would be the start of the visit. The second person says, I'm afraid of the needle. That's what freaks me out, the needle and the pain, right? And the third person said, I'm not afraid of dentists. I actually enjoy going to the dentist. Even though she didn't have, I asked her, like, did you have good experiences as a child? And she said, no, I've been there. It wasn't the best, but I actually enjoy going to the dentist. I enjoy it. I feel nothing. And she even shared with me that when she went in for teeth whitening inside the clinic, in clinic teeth whitening, the dentist told her, you know what, if you start to get a little bit of pain, you need to tell me and to stop, and we'll come back and do the rest tomorrow. She said, he did it, and I started to feel pain, and I said, you know what, I'm not going to say anything. I'm going to bear it. Let me just, you know, I'm enjoying this so much. I don't want to come tomorrow. And she was okay with bearing the pain. So that's 3 people having 3 different experiences. Then there's a modified dental anxiety scale. This one was created by Professor Gary Humphreys in 1995, so it's more recent. And he used the same scale, but he just edited a few things. He simplified the language. He added a 5th question about needle injections, which is a very common fear. And then he put it on a 5-point scale, which is not anxious to extremely anxious. I'm not going to go through too much of the details here. This is just for your own reference. If you decide, if you have the time, if you have the curiosity, this is what exists and you can use it. Now let's go on to the 3 common mistakes that make the dentists, that trigger the anxiety in patients. Would anyone like to participate? Let me know what they think the mistakes are. Or does anyone have any questions about what we've talked about so far? See, we have so many people. And there we go. Mentioning the word pain. Okay. So you think that mentioning the word pain would trigger their anxiety, or has that been your experience in the past? That's what I'm curious to know. Not hiding the needle. Yes. True. Anything else? My experience, whenever I say, do you feel pain? They get more anxious all of a sudden. Okay. Showing how anxious they are. Continuous use of jargon. Yes, using big words that they don't understand. Yes. Yes. So this is a really good observation, Dr. Abdullah, perhaps substituting the word pain for discomfort or uncomfortable, right? But uncomfortable is a little vague. So you could say, are the sensations increasing, right? The sensations, are they increasing? Or maybe even just changing it to, are you okay? Is this okay for you? You know, even that, like, language plays, language plays a big role here in priming or prepping the patient for what's coming, right? Using simplified language is better, right? Okay. So before we continue, I invite you to interlace your fingers. Let's do a stretch. Stretch the arms all the way up, jiggling from side to side. Bring the shoulders down. And perhaps taking a side stretch as well, stretching to one side. And coming back to center, stretching over to the other side. You can keep your neck facing down if you have any issues in your neck. And then back up again. Let's just roll the shoulders a few times. A few times back, up, back, down, and forward. And now let's reverse the flow. So forward, down, and back. Okay, and then shaking the hands. Maybe even just brushing the hands. Right. And noticing how you feel now. It's a simple stretch that we did, and you can do this at any point during your practice. And I'm sure it would help you to just become more focused and present to what's happening in the clinic. All right. So the biggest mistake that I've heard of is having bad chairside manners, right? Being in a rush, like having this kind of go body language, right? Making them feel like you are in a rush. Sometimes you're not in a rush, but you're asking all the questions very fast and you're not waiting for a response or checking your watch. Yeah. Just that feeling of, I don't have time for you, hurry up. Scolding them, right? Like, oh my God, I told you you needed to come earlier. Why did you wait 3 months? You see what you did? This is all your fault. Judging them, blaming them, using this harsh tone of voice to them, right? This really is off-putting. I mean, We don't like to be spoken to like that, right? Nobody does. Yeah. Or doing the opposite, looking completely bored, uninterested, lifeless, looking like, oh, I need to go home right now. I have some, like just this blank stare. Being grumpy, having your arms, you see how the body language is, crossing the arms, frowning face, or even talking on your phone. Yeah. Not giving them any eye contact. Those are like the basic things. As human beings, our communication is through body language, right? So how do we practice effective management of dental anxiety in the clinic? We are the leaders in the clinic. It starts with us. Everything starts with us. So whatever you are feeling, whatever you are thinking, however you are behaving, it reflects. It shows. We are all intelligent beings. We can all sense our surroundings. We may not understand why we are feeling the way we feel when we enter a place, when we see a person, but we always have that first impression. All of us. It's part of our makeup as human beings. So what are you doing in your clinic to create that feeling of safety? Versus what are you doing in your clinic, or who are you being as a leader of your clinic when you go every morning or every evening, right? A lot of times we are really not aware of our behaviors because they're automatic. We are living in this reactionary mindset. We are just operating day by day, just on autopilot. For us, it's our job. We do it every day, right? So we kind of lose touch sometimes. I know it's happened to me, of why we even decided to be dentists. So I invite you to do this practice, either after the workshop or on a daily basis. Just when you wake up in the morning, you ask yourself why. And it's really good if you can write them, if you can write at least 5 reasons. Why am I doing this job? Why am I going to work today? Why have I chosen this career? And the first thing that can come up is, oh, I'm doing it for the money because I need to pay my bills. That's okay. The second reason, I'm doing it because it gives me a purpose. That's a reason. I'm doing it because I feel good. Wearing the white coat, that's a good reason. Whatever reason it is, it's a good reason. But get into the habit of returning to your why, because this is what will fuel your day, and it will give you joy in the clinic on a daily basis, right? Anything that we do consistently becomes a routine, and routines become really boring, and we start to do them on autopilot. But for us, we need to become aware that we are dealing with human beings, and every person that walks in deserves to feel safe, to feel worthy, to feel a connection. We have to understand as well that some people, they don't have anyone to talk to. So it's important for us to give them that 20 minutes of care. You cannot imagine how much it would help their lives. Some of us are not good with words. You don't have to speak much, but smile, relax. Do whatever you need to do in between your patients to chill, to relax, to get in a good mood. Some of us can play music. Some of us like to hum, sing. Some of us like to talk to loved ones or look at pictures of loved ones. Maybe if you're planning a trip, focus your mind on that. But it's so important for you to realize that you are the leader in your clinic. It starts with you. And some of us, we're leaders everywhere. We're leaders in our home. We're leaders in our community. People come to us because we are dentists, doctors, because we hold that position. So it is a responsibility. Always go back to your oath of do no harm. It is so important for us to remind ourselves of this every day. Because we are human, we forget, we get busy, we get used to stuff, we take things for granted, all of us, right? So always remember that you are the leader and it's your responsibility, as much within the scope of practice, within your own scope of experience, professionalism, right? Do your best. Put that intention. Intention is everything. And if you're tired, if you're not in the good mood, if you're exhausted, be honest with yourself. Just say, I'm not in a good mood, I can't do this, right? Take the day off or do whatever you need to do. Or challenge yourself and switch it up. Switch it up. Make it a challenge. You have the power to choose, to be someone else. All right. So we can change our attitude and our body language. 55% of our communication is through body language. For the certificate, I advise you, if you're going to leave, to just wait a moment. After this slide, we're going to have a break, and you are going to have to fill out the information to get your certificate, because we need to attend the full webinar to get your 2 CME points. Okay? So we need to change our attitude and our body language, right? Simply by smiling. When we smile, and a genuine smile means that you feel it from the inside. A genuine smile is not just faking it, because people can tell when you're faking it. It's something that comes from inside. So, and this is what we have in our religion, in Islam, you know, smiling is an act of goodness, of goodwill. So it's as simple as that. Giving your patients eye contact, laughing with them, making them laugh even, right? Making light of a situation. They're coming in, they're feeling heavy, they're afraid. You can make it better. Tell a joke, you know, make something to just lighten the situation, because you know your stuff. You know you can handle it. You know they're going to come out better. You know that you're going to do an amazing job, right? You know your skills. Trust that it's a little bit of psychology here, right? It's a little bit of shifting their mindset, their physiology. And body language is number one. So open arms, feeling good about yourself, chatting with them, asking them questions. How are you feeling today? Do you see that how are you feeling today is perhaps the most important feeling, the most important question for you to ask, right? And again, reminding you of your why, like, why am I doing this? So 55% is body language. 30% is voice tone, is the tone of your voice. So become aware of the tone that you are using in the clinic. Are you using a softer tone? Are you using a harsh tone? Are you speaking really fast? Are you loud, too loud? Are you like really feeble and they can't even hear you, right? All these things make a difference, yeah? And 7% is only the language, is the words, yeah? 7% is only the words that we use. So trusting that if you ask, there's a question that I love to start my day with. It's entirely up to you if you take it or not, but how may I serve? Like, always knowing that we are in the service-based industry. What we're doing is service. It's called a service-based industry. We give services, right? So acknowledging that you have taken on this role and being okay with it, and asking, how may I serve? How may I be better? Asking yourself, obviously, not asking you can ask the patients as well. How can I help you today? What are you coming in with today, right? And being open to a shifting of the experience, like really slowing down. That's why we did the felt body experience at the beginning of the practice of today's workshop. I said, let's calm down. Let's bring ourselves back into the body. Notice how you're feeling. Notice your hips on the chair. Notice your feet on the ground. This is called a felt sense experience, right? And you can do the same thing for your patients, by the way. You can tell them, like, have a seat. I want you to just sit in the chair, take your time, right? How does it feel for you to sit in the chair? Before you begin, like, let's become aware of your body on the chair. Just bring them out of their heads, which is where anxiety lives, and into the body, back here. This would really help them to calm their nerves. Why? Because 80% of the neural messages are going from the body, from the organs, to the brain. The body is sending messages to the brain more than the brain is sending to the body. That means that if we can calm down the body, if we can get them somehow to relax or shift back into body awareness, the mind will start to settle. And we're going to talk about some of these tools now. So, Dr. Yusuf, do you want to put the links in for them to... Okay. There's going to be a link in the chat, and please use your mobile number as the requested student ID so that you can get your certificates by email. Okay, just waiting for that. As we're waiting, we could do some more exercises. I want to share with you something that would help us to get into our bodies. It's called quadrant mapping. It's very simple and it's really, really effective. And basically what we would do is we're going to start tapping on the body. So opposite arm on shoulder, and start tapping on the body from the top of the shoulder all the way down. Tapping on the inner arm all the way down, tapping on the shoulder, on the chest, under the armpit. And these are all grounding exercises. They call them grounding because it means that we come back into our bodies. Okay, then you can brush. Now we can start tapping the opposite side, the opposite arm. And you can experiment with the touch. So you could use your fists and kind of hit in that way, or you could just brush, whatever feels good to you. And then the shoulders, on the chest, and under the arms. And these are all things that you can invite your patients to do. Obviously, don't touch your patients. Let them do it for themselves. This is something that you do for yourself. And just to get ourselves back, tapping on the chest. And then as well, we can tap on the legs, on either side of the legs, from the hips all the way down to the feet and all the way back up again. I think I'm going to fill this out too. All right. And once you've done that, just take a few breaths there. So remembering that the student ID is your mobile number. What are these exercises for? These are exercises that you could use to bring people back into their body. As I said, it helps to calm down the nervous system. You see the nervous responses that are happening, fight, flight, freeze. When someone is anxious, they're afraid, they're worried, they're in their head. They're asking all these questions. They're worrying about the worst case scenario. They're feeling this fear. So when you're tapping on the body, that's why I encourage you to do these exercises for yourself, to experience it yourself, to understand what it does, right? Because it's a felt sense experience. It's something you experience in the body. So what we're doing is basically we're creating connection between us and the body, and it helps to send the signal to the brain through the nerves that I'm okay, I am safe, I am fine, everything is well, right? And then when you're tapping or you're brushing on the legs, it's the same thing. Because what happens is, when someone is worried, all the sensations are going in the center of the body, right? They're coming in the heart is racing, the mind is thinking. We want to bring the sensations back to the limbs, just come back and awaken the other sensory receptors, right? And as I said, automatically gives the person the signal that they're okay. It's not a distraction. No, it's not a distraction. No, we're shifting the physiological response. We're hacking the body, you know, so that the body starts to send the signal to the brain to calm down, right? The same thing that we do when we're breathing. When we're breathing, we're sending a signal, we're switching off. I'm going to talk about this more in the next section, so I can show you the pictures and the diagrams. So you're just brushing your legs, brushing your feet, just tapping on the body, the arms and the legs. It's called quadrant mapping. Okay, beautiful. Are we all done so that we can? Thank you. All right. Let's share the screen again. There we go. Let's continue. Now, this is just an interesting fact for you, that we can choose the quality of our thoughts. So I talked about this self-coaching method in my last lecture. You can find it on YouTube if you want to go back to this one. But essentially, this talks about these 5 factors. Okay, so circumstance is the event that happens. Do we have control over the event that happens? For example, do we have control over this anxious patient who's coming in and they don't want to do the treatment, but they really need to? No. But that happens, and then we get a thought about it. We start to think. We get a thought like, oh my gosh, this person's going to give me a hard time, for example. A feeling comes up. Following that thought, it brings a feeling maybe of anxiety or panic, or I don't want to do this anymore, right? And then an action follows. So what happens is we may decide that I don't want to deal with this patient. And this happens so fast, right? This happens inside of us so fast. And then you decide, I can't do this. I can't handle this. I can't do this, right? The result is maybe you choose not to do a good job. Maybe you choose to do the job, but then the patient gives you a really hard time, and then you end up being exhausted. The patient leaves and you're like exhausted, right? So this is all to bring your awareness that we don't have any control over the circumstance, but we have control over how we think about it. So it all starts with a thought, right? And then that brings a feeling, and then that brings an action. So those are 3 things that we do have control over. But the result, again, we may or may not have control over it, but it all starts with us. That's why it's important for us to do this practice of, why am I doing this every day? If you choose to. Again, it's an invitation. Nothing is for sure. But by using this method, if you shift your thinking, so if you think, I know that I'm doing this today because it makes me feel good. So when a patient comes in and they're anxious, and you start to think, oh God, this person is anxious, what can I do to help them feel better? How can I make this experience a better experience for them? Right? And then you start to feel more confident, and then you start to take action that is more in alignment. You start to give them the best service. You start to be slower, more gentler, more compassionate. You start to listen to them, and they end up having a really positive result. Yeah. So you can use this in any scenario as well. But for the purposes of this, understand that whatever thought you have brings along a feeling, brings along an action, brings along a result. Everything is interrelated, and it all starts with us, with how we see scenarios, how we see situations, how we see life. Emotions that people associate with the heart, such as care, compassion, and gratitude, affect the heart's rhythm and the quality of the neural signals being sent. So don't ever underestimate how your kindness, your care, your compassion can really change someone's physiology. It can change not only their experience, not only their thoughts, but their actual physiology, like what happens in their body. And I'm going to explain to you how. So how do we rewire an anxious brain towards calmness and positive focus? So there's an institute called the HeartMath Institute, and they have a lot of research on how the connection between the heart and the brain and the signals that are sent between the brain and the heart. And they've discovered that the heart sends much more signals to the brain than the brain sends to the heart. So what does this mean in practical terms? This means that by influencing the heart, we can influence the brain. So looking at this chart, during stress and negative emotions, the heart rhythm is erratic, right? It is disordered, as you can see here. I like visuals because visuals, a picture can speak 1,000 words. So looking at this is the heart rate of someone who's stressed out, who's anxious, who's frustrated, right? What happens is the heart starts to beat in this disordered, chaotic way. It sends a signal to the brain, danger, danger, danger. And then what happens in the brain? It stops the higher cognitive functions. It stops the functioning of the prefrontal cortex, which is the command center of the brain, which is right here. And the person shuts down. They're unable to think logically. They're unable to think clearly. They cannot remember. They cannot learn. They cannot reason. They cannot make decisions. So essentially, if someone is stressed out, they're anxious in your clinic, there's no way you can talk reason to them. There's no way that you can get them to calm down by trying to speak to them rationally. It's not going to work. It's not going to work because already their body has sent a message to the brain, danger, danger, danger. So what starts to operate within them? The amygdala center, which is the emotional center. So they start to become reactive and start to activate the emotional part of their brain. And then it says here, like the heart's input to the brain has a profound effect, and they start to function from that survival mode. So they start to say dumb things, they start to do dumb things, right? It becomes really chaotic. On the other hand, when we have a calm brain, like for example, where you are now, I hope that you're not under any kind of stress right now, right? Especially if you're feeling appreciation, love, compassion, the heart rate starts to become really rhythmic and regular. And as you can see, the peaks and the troughs, they're really much wider and deeper, right? You have a stable heart rate. And this sends signals to the brain that I'm okay, I'm safe, everything's fine. That explains, like when you're with family and you're having a good time and you're laughing, you feel really good, right? And your heart is rhythmic and is sending a signal to the brain, I'm okay, I'm having a good time, everything is well. And then you're able to make rational decisions. The prefrontal cortex, the front part of the brain, is able to function really well. You're able to decide and plan things and do fun stuff together and make jokes. You're able to think clearly, you're able to remember, right? It has that positive effect on us. So that means that if we learn to generate this coherence, this breath, this alignment, a rhythmic pattern in the heart, we can do it through sustaining positive emotions. And it has an effect not only on the body, but on how we think, how we feel, how we perform. It affects everything. Okay, so this is just another visual for you to see the difference between a frustrated heart rate and an appreciative heart rate. Okay, so that means that if we can feel, there's something that, if we can feel appreciation, if we can feel it ourselves, love, compassion, doesn't matter if it's towards the patient or not, but in general, if we feel grateful to be where we are in this stable state, so we are able to think better. And then we are very possibly able to bring our patients into that state as well, right? We're able to, by showing them care and compassion, their alarms in the mind start to go off, and they're able to slow down and calm down and start to function from that mastermind. Okay, which is, here's the visual. This is the neocortex is the full thing. And then here, the front is the thinking brain. It figures out the how, the what. And here inside, we have the limbic brain, which is where the amygdala is, which stores our emotions, our memories. It's the feeling side of us, right? It's the part that gets triggered when people are anxious. They're not functioning here. They cannot function here. If they're anxious and they're worried, they're here. And this is where all the stored memories are. So anything you could do could trigger an old memory, right? Even the sound, like, so even dropping tools might freak them out, right? Because they're in full alert and this part of the brain is functioning. And sometimes even the reptilian part of the brain is functioning, which is like when they've completely lost control and they're just completely gone mad, right? They haven't gone mad. It's just that they're unable to function from this thinking brain or even the emotional brain. They've gone straight into survival. Okay? So that is just really basically what we are doing when we are telling them to come into the body, calm the body down. We're able to tell them, let's take a few breaths. I'm going to teach you a few breathing exercises that are super effective, very fast. That's what happens. You're switching off the reptilian brain, you're switching off the limbic brain, you're switching on the neocortex. The heart is sending signals to the brain. Calm down, I'm okay, I'm safe, you're safe, you're safe, you're safe. So by changing the breathing pattern, we can produce a different state of mind. Unconscious breathing, what you're doing right now, we're not thinking about breathing, it's coming from the medulla oblongata part of the brain. But conscious breathing, when we tell them to breathe in a certain way, when we are being told, let's do this kind of breathing, it comes from the more evolved part of the brain, the cerebral cortex, which we talked about. So that's why deep breathing and slow breathing has this relaxing effect and a balancing effect on the emotions, on the hormones, on the whole cascading system. Okay, so in essence, by consciously breathing, you are controlling which aspect of the mind dominates, causing your consciousness to rise from the primitive part of the brain, the back of the brain, and you're able to function from this front part of the brain, the forehead part. So essentially, breathing can control the mind, body, and emotions. So this is coherent breathing, and you have these on your Garmin watches. If you have Garmin watch, this is part of the practice, the training that is there. You can use this for yourself. And obviously, the more that you do this throughout the day, the more you get used to doing it, and the more you can reach out to it when you need it. So it's like good self-care, basically. This is good self-care for you to get into the habit of just really deep breathing so that you're training your nervous system to be in a calm state at different times of the day, so that when you need this skill, this tool, you know how to get there very fast. It becomes like an automatic reaction, right? And then you can teach that to your patients as well. It's very easy. Let's do this together. So basically, we're going to have equal inhalations to exhalations. So we'll start with 4. We'll take 4 breaths in, or we'll count to the count of 4. It's just 1 breath, and I'll count you up to 4. And then we exhale, counting 4 to 1. Okay? And yeah, so I invite you to do this with me. Just sit with a tall spine, roll the shoulders back, and begin to fully exhale completely from the nostrils. We breathe in and out of the nostrils, the nose. So let's breathe in. 4, 3, 2, 1, holding at the top, exhaling from the nose. 4, 3, 2, 1. Breathe in. 4, 3, 2, 1. Breathe out. 4, 3, 2, 1. Breathe in. 4, 3, 2, 1. Breathe out. 4, 3, 2, 1. Again, last time. Breathe in. 4, 3, 2, 1. Breathe out. 4, 3, 2, 1. Just relax, breathe normally. naturally. All right, so it's important for us when we're doing this exercise to breathe in at the same rate and in a rhythmic way, okay? And you have these on your watches, you can do them any time of day. The other kind of breathing that I really love, and I've been using it so often, is this ocean breathing, which is the one that we did at the start, right? So at the start, we had this ocean breathing where we were breathing in and out of the nose. This time we're going to do it through the nose. And as we're breathing out, we're constricting the throat and exhaling out of the nostrils, but we're as if we're pushing the air out of the throat. And this one targets the vagus nerve, which runs along the line at the sides of the neck. And the vagus nerve is that very important cranial nerve that serves and sends signals. It's the highway for all the signals of the body, from the body to the brain, from the brain to the body. So when we activate this vagus nerve, it helps the body to say, I'm calm, I'm safe. Okay, so we can try this now. And this could be our, so let's begin again by breathing in. And this time really forcing the air without any counting, pulling it through the back of the throat. So you should feel it on the back of the throat like this. It's a bit of a Darth Vader kind of breathing, but it really helps to trigger the parasympathetic nervous system, which is the rest and digest part of the nervous system. Questions here. Which part of the brain completely separates us from other animals and mammals? To be honest, this is not something that I've studied, but if I was to deduce this logically, I would guess the neocortex. I think it's the part of the brain that is the neocortex, which is the functioning one, which is the rationalization, decision-making. That is what makes us superior, right? We are able to make decisions. We are able to make choices, you know? So yeah, Fajr, thank you. Amazing lecture, valuable information. Love the exercise, so helpful. Okay. Before you leave, we still have like a few minutes left, but before you leave, I'd appreciate it if you could answer my survey. I have a survey here, and I'm going to put it in the chat box in a minute. So another thing that can activate the nervous system is the humming, which is just singing. And again, this activates the vagus nerve, so it helps to calm down the nervous system. And the acupressure points, we did some of them today. One of them that I really want to share with you is the one on top of the shoulders. It's at the peak of the trapezius muscle. It's at the peak of the shoulders. If you just use your index finger and your middle finger to just press down and create these little circles. And you can encourage your patients to do this as well. I mean, please don't touch them. We're not, you know, if you do, you need to ask for consent to touch anyone, right? So just doing that for a few moments, pressing down and then rubbing the hands down. And that helps to just relieve some of that stressful energy. Another point is between the eyebrows, just pressing here for a few seconds. This one really helps to relieve mental stress. These are all acupressure points. And just let go. Beautiful. Another one is here in the web, large intestine 4. And all these things I practice in my yoga classes. If you're interested to attend any of my classes, I teach on Thursdays at True Yoga Studio in Salmiya. A very gentle kind of style. And we do a lot of this acupressure points and these breathing exercises, and they really help. And then just release. Beautiful. All these are like body hacks. And lastly, we can ask them to do this grounding exercise. If they're really unable to focus, just ask them, can you look around the room? We're engaging their senses. What do you see around the room? And ask them to name it out loud. What can you feel in your hands? What are you touching? What can you hear with your ears? What are you smelling? One thing that you can taste. All these bring us back into our awareness. So in summary, what is our role here? Our role is safety and choice. Always give people choice. Empowering them with positive language, telling them that they can make it, they are strong, they'll be able to live through this experience using a gentle approach, and understanding the nervous system, because the more you know, the more you have compassion. You understand that it's not something that's voluntary, that's not really conscious, it's just a reaction, right? And I want to end with a quote from Maya Angelou, which says, I have learned that people will forget what you said, they will forget what you did, but will never forget, how you made them feel. Okay. And these are your references. If you'd like a copy of this lecture, you can contact me. These are my contact points. There's my Instagram, my website, my email, and I'd be happy to answer any of your questions. I'd love to see your faces attending as well, if you'd like to attend these classes, because they really are valuable and they really do help you to just get a grip of life, right? So I'm going to put my feedback form here. I'd appreciate it if you could answer it for me. And if you do answer it, then you'll find a little 15-minute video, a grounding exercise for you to enjoy on your own on my YouTube channel. And as well, if you're interested to do one-on-one coaching, I'd be happy to help you. Just reach out and we can take it further from there. So in the end, thank you so much for being here. I appreciate all your feedback, and take care of yourselves. And I believe in you. Thank you so much.
Thank you, Dr. Farah, for the very informative and beneficial presentation. Thank you for your great efforts and time. We would like to send you, as usual, a certificate of appreciation in recognition of your valuable contribution in this webinar.
Thank you
Please,
so much. Thank you.
hope to meet you all again in our upcoming other events. Thank you.